and welcome to another training video for the ICRS Patient Registry. In this video, I will be showing you how to put Durolane and Gelsyn-3 products into the registry. I will be assuming that you have already entered the patient into the registry, or the patient has already enrolled themselves. If you need further information on how patients can enroll themselves or how you can enroll the patients on their behalf, then please take a look at our other training videos, which are available on our website. So in this example, the patient has already enrolled themselves in the registry. And when you sign in to the registry, you'll be greeted with this landing page. And what you'll see, first of all, is all of your patients listed here. So if we go into the top patient, we will see here that their outcome measures have already been completed by the patient, and also that they have enrolled themselves already and completed information on their patient history and weight and height. If your patient has enrolled themselves, the first thing you'll need to do before completing any of the forms is just confirm what side the patient is having their treatment on. So to do this, you'll need to move from the clinical record to the pathway detail by clicking this button, and then in the side, clarifying whether it's right or left. You then click Save, and then you're ready to move back into the main clinical record and complete the questionnaires, and I'll show you how to do that now. The red outlined documents are the ones that you need to complete for the patient, and you will see that there's one for before they have their treatment and one for after they have their treatment. And you can actually complete both of these forms in one within the treatment form. And you can access both of these forms using the tabs here as well. So the pre-procedure form is the same as the clinical assessment, and the procedure treatment is the same as this form here. So we'll do both forms in one for the purposes of this training. So first of all, we need to click the date that the procedure was performed on, and let's say that it was the day that we're recording this training. And because we haven't finished the first form yet, we need to click Dataset and Complete Procedure Record. And then start going through the mandatory questions for the registry. So first of all, answer a question on the health of the opposite knee and which hospital the procedure was completed at. And this should come up with the hospitals that you work at or the clinics that you work at. You'll see that some questions are not outlined in red, and these are optional questions. So then you'll need to click yourself, or if you're a delegate, the consultant or clinician who was in charge of the procedure, and then whether they were the lead specialist. Then provide some information about whether anaesthetic was used. And this is where you would then put the information on the product. So check that it's primary and click injection, and provide some information on EUA at outset if you want to add this optional data. Antibiotic use and skin prep is also optional. And then to identify the treatments, click hyaluronic acid, and then either Durolane or Gelsyn-3, which are listed here, depending on which was used. So for this example, I will click Durolane, and you will find that the questions that are triggered under both are exactly the same. So in this box, provide information on how the volume of the injection, and then where the arthritis was located in the joint. So if the patient had arthritis in multiple compartments, then you can click more than one. So here you'll see it's asking you for the grade for the patellofemoral joint, and it's also asking for the medial compartment because you clicked both up here. You'll then need to provide information on whether ultrasound was used and whether effusion was present in the joint. If you don't know, you can click unknown. And this is an optional question, but if you do click yes, then you are also asked another optional question about the effusion grading. And if you do not know, then you can leave this blank. Finally, what was the injection approach? You can choose superolateral or other. And if you click other, you can provide optional details on the approach. And then next, just some couple of questions on complications and post-op treatment. So you can let us know whether there were any complications, and if there were, there are a few more questions for you to answer. But we suspect that the majority or all will have no complications. And then you can provide some information on whether the patient was prescribed a brace after the treatment, and what their weight-bearing protocol is, and whether they were to have physiotherapy afterwards. And if you'd like, there's a free text box to provide more information on post-op instructions. Finally, you're presented with the pre-treatment form. So this is the one that we did not complete initially, but because we clicked the right-hand button at the top of this form, it's triggered the form at the bottom here. And this is just letting us know what the patient's condition is, and the things like their duration of symptoms. So these questions are optional. You can provide this if you know. And then the first mandatory question is, has the patient had previous injections on the knee? So if they have, you can click that they have had previous HA injections. And in this example, we'll say they haven't had surgery before. And then if they've had any associated injuries at the same time, and you might not know in this case. Next, it's asking you whether the alignment was normal, excess valgus or excess varus. And if you know, you can provide the underlying cause of defect. So, for example, you can choose osteoarthritis here. And then some final questions on whether the onset was sudden or gradual. Again, this is optional. And what the patient's activity level was. And once you've done that, you can save the form. If you are putting in a lot of these injections, you can save this form as default. And then every time you come in to put in a patient with Durolane injection, you can just click the pre-saved Durolane form. And for further information on how to create this, then please watch our tutorial, which is specifically on the default form. So then I'll save this. And then you'll see that the procedure treatment form has been completed and is coloured in black. And you'll also see that the initial clinical assessment has been completed because we filled both forms in at the same time via the procedure treatment form. Finally, you'll see that future tasks have now been triggered for the patient, and this is based on the date that the injection was performed. So it's really important that you add the correct date here, otherwise the patient's follow-up questionnaires will be triggered on the wrong date. So this will then show you what the patient will be receiving over the next few years. Thank you very much. If you have any questions, please do get in touch with me. And if you need further advice on how to use the registry, please take a look at our website where you can find our other tutorials and also a link to a webinar that we ran last year.